Hello everyone, I am Sakshi Dhanokar. Today we will discuss about the pharmacovigilance. First we first we start about the pharmacovigilance. We know most about the drug and the adverse drug reaction. So what is drug? Drug is the compound or a chemical entity used for the mitigation, treatment, diagnosis of a disease. And what is ADR? ADR is the adverse drug reaction caused by the administration of a drug. So ADR and the drug is an important term that used in a pharmacovigilance. All over the pharmacovigilance based on this ADR and the drug. Pharmacovigilance is the most important topic concerned with the as far as concerned with the drug safety. So what is pharmacovigilance? The first question arises in your mind, that is what is a pharmacovigilance? Pharmacovigilance derives from the Greek word that is pharmakon and the vigilance. The pharmakon means the drug and the vigilance means to keep watch. So pharmacovigilance is the term that related with the to keep watch on a drug on a patient. So according to WHO 2002, pharmacovigilance is a science or activity related with the detection, assessment, understanding, and the prevention of ADR. Now, other some cause like counterfeit medication, drug abuse, drug misuse, drug use in a pregnancy, over-the-counter drug, etc. So, similarly, pharmacovigilance is a program in which we are watching or keep watching the effect of drug. As we know, kind of effect of a drug can be produced. Drug produce better effect, beneficial effect, and sometime produce sometime drug produce cause side effect, or we can say it as a ADR, that is a adverse drug reaction. Pharmacovigilance used for this assessment of adverse drug reaction, detection of this adverse drug reaction. Then we see the purpose of the pharmacovigilance. The main purpose of the pharmacovigilance is the rational use of medicine. So rational use of medicine, that means the adequate use of medicine, appropriate use of medicine, then medicine use in a economic way, then decrease the drug related effect or reaction to the patient, or reduce the harm related to the drug, then safety of the drug for the patient, study of drug for the patient, etc., or to improve the drug safety and the care in a patient, to then communicate with the healthcare practitioner or patients. So, according to this definition of a pharmacovigilance, the term assessment means the assess the reaction, identify the reaction, then understanding means the causality, the cause of the reaction, the reaction caused by the suspected or any other reason, or then prevention of the reaction consists in this we find the adverse drug reaction of the drug, then change the labeling, withdraw the drug from the market, etc. So pharmacovigilance is the most important approach nowadays. The pharmacovigilance come in existence before 169 year ago, when the young girls Green Anna had taking this chloroform anesthesia before its surgery to removing its infected toenail. He concepted this anesthesia causes, after that congestion he caused death. The date of this young girl is unknown. After some time, the date of this girl identified cause this death caused by the consumption of this chloroform anesthesia causes pulmonary infection and the arrhythmia. So after that he say chloroform anesthesia is banned from the market. After that, the 1937, 107% get die in the US due to the consumption of sulfonamide alexia. Due to this, because of sulfonamide alexia consists diethylene glycol solvent. It is a toxic in nature. Before that tragedy, the companies or pharmaceutical companies are unknown about this solvent. They cause a toxic effect. After that tragedy, they banned from the market. Then 1961, the largest and the biggest man-made disaster occurred due to the consumption of thalidomide. Before this tragedy, the thalidomide used in western countries for the nausea, morning sickness in a large amount. After that, they use in India for the pregnant women, for the morning sickness. They cause the congenital defect of the offspring in the pregnant woman, causes the phocomelia. Phocomelia is a term in this. The newborn baby consists the short limbs and abnormal babies. So after that, this tragedy, the pharmacovigilance rapidly developed in India. After that, the pharmacovigilance programs of India, that is PVPI, developed in the India, or it is entered in the India in 14 July 2010 by the government of India with the Association of Control Health Organization, New Delhi. National Coordinating Center after shifted toward the Indian Pharmaceutical Commission, that is IPC, in Ghaziabad. The main vision of this PVPI program is to protect the Indian population from the ADR, and the mission of this PVPI program is to avoid the ADR in our country. There are some activities consist of pharmacovigilance in, that is the post-marketing surveillance, dissemination of adverse drug reaction. Third one is the changes in labeling of drug. So in a post-marketing surveillance, we know about how the drug show their effect, their efficacy, how much ADR they produce. The post-marketing surveillance are done by using ADR form filling, voluntary reporting. In voluntary reporting, both SCP and non-SCP get reported. Then prescription event monitoring, computerized record linkage, cohort case studies, etc. Then dissemination of a ADR. Dissemination of ADR consists by using drug alert, medical letters, etc. Then changing labeling of a drug. Changing labeling of a drug, if there is a side effect, some serious side effect, then what cause the organization. If changing in labeling means if there is a side effect of a drug or adverse effect of a drug, then what the organization taking step in this condition, that is the change in labeling. In this case, we change the dose of the drug, then concentration, reduce the concentration of the drug, withdraw the drug from the market if there is a no, if there is a no change in, there is a no change in ADR, etc. There is a center, that is Upasana Monitoring Center, that is a UMC, and the CDSCO, that is the Central Drug Standard Organization, consists casualty assessment studies and the severity studies by collecting, disseminating, communicating the data to the healthcare participants or SCP or companies, public, patients, etc. by using a casualty assessment consists the Naranjo algorithm scale and the spreading Hartwig scale. So this is all about the introduction of pharmacovigilance. Thank you.